Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. So Marghoub, tell me what's going on with your shoulder. What happened?
When I'm moving my shoulder, I have painful.
How much pain from 0 to 10? 10 is emergency room.
It's 5 to 6.
5 to 6? Can you show me the motion that caused the pain? Like lift it up and tell me how much pain?
They have the painful thing like this.
5 and 6 in there?
No, it's going more.
Like how much from 0 to 10? 8?
9.
Okay, can you bring it back like this?
Yes.
How much pain with that too?
This time no, they're not pain.
No pain? Okay. This motion, and what else is difficult for you to do because your shoulder pain?
This they have the painful.
Okay. Can you bring your arm back here?
Yes.
Okay.
It's this time no pain.
Okay. But when you do it straight. So how long this been going on? You can relax.
For 3 months.
3 months. How did you hurt your shoulder? What did you do?
I don't know this when I'm suddenly I feel
Suddenly no falls or injury or anything. Have you had any treatment for your shoulder before coming
not
here?
yet.
Okay.
I'm making salon pass and cream.
Okay. But you still feel in pain there?
Yeah.
Okay. So what else is difficult for you to do? Lifting the stuff or taking your clothes off? Do you have problem with that?
Yes, when I remove my shirt and
When you take off your shirt,
take off
okay?
my shirt,
Okay.
that's hurting.
It's hurting. At worst, how much from 0 to 10?
It sometimes it's going 8
Uh-huh.
or normally it's 5, 6.
Okay. All right. So, okay.
Yesterday they give me the injection.
Okay.
Still I have the pain.
So you had injection and you yeah, and you still having pain.
Yeah.
Okay. Pain.
They start the pain.
Whole thing. 130 flexion. And we're gonna do shoulder abduction. Okay. So bring it up toward your ear.
They are painful now.
Painful?
Yes.
It's 125. Okay. Oh, it's actually 132. 130. You see that? Get the whole thing up. 130 abduction. So we're gonna do internal rotation. Okay. So bring it down. That's normal. It's 90 degrees. That's fine. Okay. External rotation. Let's see how far we can get the whole thing. So this is 70 degrees. 70 degrees external rotation. Let me know if that's painful, okay? Any pain with that or it's okay? Okay. So it just happened randomly, you know,
Yeah.
no injuries or
No
anything. Okay. Make sure this is not painful. Sorry. Okay. Sorry, sir. Okay.
Cái này em làm gì? Cái snack on that. Okay. And it doesn't have any extra. Oh, really? No, that's where it's going. Oh, thank you.
You got a big knot here. That's a big scar tissue. Okay, I'm just doing this for the camera. It's not the best ergonomic, but you guys don't do that at home, okay? Is that painful?
Little.
A little bit, okay. Make sure you let me know, okay? We don't keep secrets in the camera, okay? How's that? Are you trying to show off now?
Yes, it's better now.
Better, no pain? As far as you can. Pain is good. Okay, so this is 165. Okay, let's do abduction. How much was abduction?
130.
130. Okay, so let's bring this up and toward your head like this. Yeah. So that was 130. Okay. The camera in the way. Okay. So that is like 178. 178, 130, 178. That's good. Okay. So I know that the internal rotation was normal, so we don't need to take that. That's the external rotation, how much it was? 70. Okay, so let's bring this back. 70. This is 90. Oh, more than 9. That's perfect. Don't have. Here you go. You see the numbers? 90 degrees.
Nice.
Alright. Okay, about the treatment, just working on your shoulder for a few minutes. ASTR treatment.
It's very good.
Yeah? Can you tell the difference?
Yeah, I have so many different.
Yeah, you feel
Before
you could not lift your arm. But now you
Now
move
it's
it.
good.
You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.